Your back hurts with pain that radiates down your leg. What's causing that pain? We have two spine specialists with a diagnosis.
Back pain is the second most common reason patients going to visit their physician. And most of the time it doesn't radiate. Most of the time it's simply just back pain. But for the patients that come to see us, a great number do have pain radiating down their leg. And it's probably the single most common thing that we see, which would potentially require intervention, either injections or, in a lot fewer cases, surgery.
Now, right off the bat, I want to remind our viewers that you can call in and ask Dr. Mena and Dr. Gottlieb a question by dialing 855-796-4475. We'd love to hear from you. Now, we're going to talk more in depth about herniated disc, but first, let's get a spine anatomy lesson. Let's take a look.
The spine is an interconnected complex of bones, nerves, muscles, tendons, and ligaments, any of which can become damaged and cause pain, neurological symptoms, or loss of mobility. The vertebrae are the bony building blocks of the spine. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the upper back, and 5 lumbar vertebrae in the lower back. Each vertebral segment is comprised of a cylinder-shaped bone in the front of the spine called the vertebral body, a soft cartilage disc between each vertebra, and paired facet joints in the back. Each segment is named for its upper and lower vertebra, such as the C6-C7 segment. The bones in the spinal column surround and protect the spinal cord, which runs behind the vertebral bodies in a canal from the neck down to the top of the lumbar spine. In the lumbar spine, the nerves branch out from the spinal canal and exit the spine in a pattern that resembles a horse's tail, called the cauda equina. At each segment, spinal nerve roots exit the spine through holes in the back of the vertebrae, called foramen. Any compression of the nerve root in the foraminal opening, which can occur due to bone spurs, herniated or degenerated discs, or facet joint problems, can cause pain and possible neurological symptoms to radiate along the path of the nerve. These symptoms are commonly called radiculopathy, and leg symptoms may also be called sciatica. In between the vertebrae, the intervertebral discs serve as shock absorbers and help facilitate movement of the spine. These discs can degenerate over time and become a source of pain, a condition called degenerative disc disease. The soft inner core of the disc can extrude, called a herniated disc, and inflame a nearby nerve root. Pain radiates along the path of the affected nerve and into the arm or leg. The sacrum connects the base of the spine with the pelvis at the sacroiliac joints. If these joints are too loose or too tight, it can cause lower back pain due to sacroiliac joint dysfunction. Below the sacrum is the coccyx, or tailbone, which consists of several small bones. Any damage to this area can cause tailbone pain. The entire spine is knit together by a series of interconnected ligaments and tendons that help support and stabilize the spine, while allowing a great deal of flexibility.
Okay, that was a quick anatomy lesson here of the spine, but you're going to break it down for us, literally, Dr. Mena. They are shock absorbers, correct?
That's
as the
correct.
video said. So explain that concept a little bit.
So essentially what this does is that it absorbs the energy that is coming throughout the spine. So we have one in between each bone. So what happens is that the most mobile segments of the spine, meaning the L4-5 and mainly the L5-S1 in the lumbar spine, the lower levels, normally they degenerate the most because of the constant wear and tear. And those are the most common ones that they degenerate, they get weaker, and they are more propense into developing into disc herniations.
What are they made of?
They're made of fibrocartilage. That's the consistency. So normally we have the jelly inside, which we call the nucleus, surrounded by a fiber, which we call the annulus. So typically the fibers from the outside, the annulus, they break, and that's where the herniation, they start tearing as part of degeneration. And the center of the disc comes out, and actually that's what we call a herniated disc. And on occasion we'll compress a nerve or touch a nerve, and that's when they develop the sciatica or the symptoms going on down the leg.
And besides serving as shock absorbers, Dr. Mena, what else do the discs do?
So that's basically their main function, actually being shock absorbers. So they dissipate the energy away, but they wear out like any mechanical, like the cars, etc. So they can degenerate, and they eventually can slip out and cause what we call the herniated disc.
Thank you for that, Dr. Mena. And we actually have Dr. Gottlieb at our 3D monitor. He's going to explain to us how a disc herniates and why it causes pain. So let's get to that, Dr. Gottlieb.
Absolutely, and I think the place to start is really looking at the normal anatomy. So as Dr. Mena was describing, the disc is really a shock absorber and also serves some degree of structural function. It's made up of the two components, the softer part, the nucleus pulposus, which is sort of the jelly. When people talk about some of the jelly came out, it's a piece of the nucleus. And the outer rim is a thick, almost leathery-like substance called the annulus fibrosus. And the annulus is made up of the same type of collagen that your bone is. The inner part, the nucleus pulposus, has a lot of the softer type collagen in there. So a normal disc is quite efficient at absorbing and transmitting forces. But eventually, as we start to age a little bit of degeneration occurs, we start to lose some of the structural integrity in that annulus.
Right.
And additionally, if we have an injury, there's the opportunity for a piece of the nucleus pulposus to start to bulge out. So a normal disc demonstrates the annulus holding the nucleus in place, and it dissipates the forces nicely. But if there's a significant injury, or if a significant amount of degeneration has occurred, the opportunity for a piece of that disc to basically slide out exists. Now that piece of disc coming out might just bulge out a little bit, but if it bulges out and starts to push on a nerve, that's where you can start to experience that pain, numbness, tingling, or weakness down the legs.
I noticed in the image of the herniated disc, and we're seeing that redness in the nerve there. Where is that pain radiating? Where will that patient feel the pain?
So typically when a disc herniates, and the moment that it herniates, and sometimes even for a short period of time after that, a day or so, even if it's pushing on a nerve, the primary pain is in the back. Within a couple of days, though, the inflammation will ultimately result in the nerve becoming inflamed.
Right.
And that sort of red area that we see right there represents the inflammation. And so you'll transition. A lot of patients will start off with just back pain, and then a day, 2 days, 3 days later, start to have that radiating pain, numbness, and tingling. And that's sort of represented by what we see on the nerve there, and then we'll extend further down the leg.
Want to see more of this episode? I don't blame you. Just download our free Health Channel app.